Hey guys, it's Dr. Francesco Fascetti. I've got him here today to explain a little bit more about what a Brazilian butt lift is, a BBL for short. Now when you reached out to me, this is the first time I've ever heard of it. I've heard of butt implants, but I've never heard of a Brazilian butt lift. Can you tell me what is a Brazilian butt lift?
Absolutely. Brazilian butt lift is a permanent change in the shape of your buttocks that we achieve transferring fat from other areas of the body, such as the lavendals or the inner thighs, the abdomen, and re-injecting the fat washed with antibiotics into the buttock cheeks.
Okay, so you're removing certain pockets and then just putting it into other areas that need more
That's
volume.
correct. It's your own fat that we move from one area to another area of your body.
Another question that I have is, when it comes to breast augmentation, there are cup sizes you can kind of go off. When it comes to your behind, however, how do you go and say, okay, I want it this big, or is there like sizes that you go off, or do patients wear like those bum paddings to see what it looks like?
That's a good question again, and might sound funny, but we refer to three categories of examples that are really popular in the mind of our patients. So the smallest size of BBLs that we can do, we call it a sports illustrated. So it's a nice sporty buttock.
So what you would see in the like magazines or like girls in bikinis, so nothing too crazy.
Correct.
Okay.
It's nice, round, toned up shape. The second category, a little bit bigger, we call it Beyoncé. And the big one, as expected, is a Kardashian. I have to say that the vast majority of ladies, they prefer Beyoncé, so it's an average size. And we put around 600 mils of fat in each buttocks.
Okay, so how many syringes is that roughly?
Each syringe is about 50 mils, so let's say about 12. It depends on the size and the type of the buttocks, cheeks of the patient, because some patients, they have more muscle, so they need less fat to obtain the same size and shape, or vice versa, and depending also on the skin and the structure of the body.
Okay, and with this procedure, what are the risks involved? I mean, like with any cosmetic surgery, there are risks, but what are the main risks with
Absolutely, that's important for the patient to know. It's a very gentle procedure, first of all. From the first step of liposuction in other body areas to the re-injection of the fat. It's very gentle because the ultrasound, they gently melt down the fat. There is no a lot of pushing and pulling like in the old traditional liposuction.
The pump and action that you would see.
Correct, but we use the Vaser machine. So we practice Vaser Liposuction at Cosmos Clinic. The swelling, the bruising, they are minimal to nothing. It's extremely unlikely to have a big bruise afterwards because we are extremely gentle. And in terms of infection, it's extremely unlikely as well because all the procedure is done under full sterile, full aseptic technique, and the fat is washed with antibiotics before re-injecting into the buttocks, and plus the patient is having antibiotics for a week after the procedure, so everything is under control.
And why do they call it a Brazilian butt lift? I'm like, why do they call it that? It was in Brazil it was created? Or?
Yeah, it was created in Brazil by a
so
Brazilian surgeon, and nowadays the perception of the meaning of Brazilian butt lift, of the procedure, is because we modify the shape and the sides, giving more projection and lifting in a perfect Brazilian style.
And when it comes to, after the procedure, what's the aftercare? Is there a downtime?
The downtime for work-wise, is approximately 1 week because mainly the areas where we practice liposuction to obtain the fat can be sore for a few days, up to 1 week, like if you work hard at the gym. It's not high-pitched pain, but it's just soreness. When we transfer the fat into the buttocks, the most important thing is that the patient cannot sit with the full weight of the body on your buttocks for 2 weeks. That's the most important thing.
You cannot sit on your bum.
Exactly right, because there is an increased risk of killing the fat cells.
Yeah.
So increasing the risk of infection and increasing the risk of reshaping and squeezing the buttocks.
Did not know that. I mean, like I said, I've got crazy Japanese nails and it's been a week and I can't do anything with it. I can't imagine not sitting on my bum for 2 weeks. I mean, are you constantly standing?
No, honestly, I have to say the patient, they deal pretty well with this, and 2 weeks they pass really quickly. But what patients can do is sitting on the back of your thighs, so leaning forward.
So just like perching on.
Yeah, you can sit, just leaning forward and relieving the weight from your butt cheeks. There are also specific pillows that you can buy that they make you sit on the back of your thighs, relieving the
What about when they go to the toilet? Because
you just lean forward.
you just do the squats like it's a public toilet. You don't want to sit on the seat.
No one ever complained about this, so I think they can
no
work
one
out
ever
a way.
asked. I've just got a wandering mind. And if someone wants to actually get this, how much does the procedure roughly cost? I mean, it would vary on how much.
It depends on the amount of fat and number of areas that we do, but generally it starts from 7,700 for 1 year of liposuction plus fat transfer into the buttocks, going to $11,000 for 2 areas of liposuction and fat transfer into the buttocks, and adding
Okay, so
a bit more
it
depending
depends
on
on
the
how
number of
many
the areas.
areas you're working with.
Yeah.
Okay. Ooh, it is a little bit pricey, but do you find that this procedure, this treatment is becoming more and more popular these days?
Certainly, for sure. We've been practicing fat transfer into the buttocks for a few years, and in the last couple of years has become much more popular and requested. I suppose because the increased popularity of these public figures like the Kardashian sister, like Beyonce.
Thanks to Instagram.
Thanks to Instagram, absolutely, because it's visual Instagram, and people need to see what to expect, and became so popular that now we have several appointments just to talk about Brazilian butt lift every single week.
Lots of inquiries, wow.
Lots of inquiries, and we do 3 or 4 procedures every week.
Wow.
It's skyrocketing now, the request for BBL.
Yeah.
And will become more and more accepted and popular because people want more confidence in their look, and they want a better appearance. They want to be more visible. And all these kind of procedures, they boost the confidence of patients incredibly. So I think it will become more and more popular and on demand.
Wow. Okay, well, that's all the questions I have today. Thank you so much for, sharing your knowledge and just answering some of my questions. Some of them weren't, going to the toilet. Let's, only I would ask that. You guys know. But thank you so much.
It's part of the normal lifestyle.
It is. It's just, I wonder about those things.